is South Florida's Health and Wealth Radio, AM 1470, WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to the CareGiver Reality Show, hosted by gerontologist and family caregiver expert David Levy, speaking on a topic that is not only a national problem, but an international one, and represents one of the biggest dilemmas facing us today: Alzheimer's disease and dementia. With no cure in sight and hundreds more being diagnosed weekly, Alzheimer's is more feared than cancer or heart disease. Join us as David Levy breaks it down and educates, informs, and explains useful caregiver strategies and techniques that 25 years of non-clinical family caregiving have taught him. You can listen or call in and be part of the show. 888-565-1470 to ask your questions. And now, here's David Levy.
Good evening, Boca Raton, America, and the world. This is the CareGiver Reality Show. I'm your host, David Levy, and we're broadcasting to you over WWNN 1470 AM and on caregiverreality.com. Just go there, click on Live Show, and you'll see us in living color. You want to call in? It's 888-565-1470, and we got a busy show tonight. Our call-in guest at 7 o'clock is a phenomenal gentleman by the name of Jaime Fitzgerald. He's the executive director of the Area Agency on Aging, and while that may not sound exciting, he's the guy that really controls what happens to older people in this county and in many other surrounding counties, because he's the area agency director for most of the Treasure Coast. And at the same time, as I've been telling you weekly, we have been getting involved in enrollment into Medicaid option, which is we're one of the first states to begin it. And he will be able to tell us what's going on because it all happens underneath his wing. So that'll be at 7 o'clock. Stay tuned. I am sure you will find it interesting. Caregiver Reality, we're a little science, we're a little human interest, we're all about caregiver education, support, respect, and quality of life for caregivers and their loved ones. And we're your competent authority on information that you need to know in order to make wise decisions. And, coming up in just a few minutes, we'll have our first winner of the Arden Court Day of Respite. We have our first winner, and we'll be announcing her name in just a moment. I wanted to start out tonight by giving you a little caregiver hint, because there are a couple issues that arose this week. There was an article about pills that could combine many, many different medicines together. They were calling it the poly pill. But we have a bigger problem that most caregivers are very much aware of, and that's called polypharmacy. And that's called what happens when mom, dad, or whoever it may be, your spouse, is taking 7, 8, 9, 10, 11 pills. Now, that is an ungodly amount of pills. And I'm not saying that every one of them isn't needed. But here's the problem. You take all of that medicine, and many people take most of their pills all at one time. You are making drug soup. You have no idea when all those medicines go in what else they're creating, or whether or not they're counteracting each other, or whether or not they're increasing the potency of one. And so it can be very, very dangerous. So my suggestion is, as I've always made it a request, is that not only do you carry a list of your medications, but you go in and you ask your pharmacist, give me an idea with all of the medicines that I'm taking, mom's taking, whoever it may be, which ones are really dangerous to take together. Because when you go to your doctor, each doctor has prescribed a certain amount of medications for you, and no doctor is going to take you off another doctor's meds. But what you have to understand is many times these medications have just been renewed and renewed because it's the simplest thing to do. So one of the things I advise caregivers is when you go to the doctor, you show them, along with everything else, the medication that your loved one is taking, and you ask, do we still have to take all of these? Do we still have to take them in the same potency? And what's the best time to take it? Many times it'll say, take it in the morning and take it at night. Is that before or after a meal? Is that 8 o'clock in the morning, 6 o'clock in the morning? And the reason I say it is because we have something called circadian and biorhythms. And at certain times of the day, we create certain hormones and other chemicals in our body. And it just very well may be that the pill you're taking has more effect at a different time in the day than just the standard twice a day, 3 times a day. And I always ask, is 3 times a day breakfast, lunch, and dinner, or is it 6 in the morning, 2 in the afternoon, 10 o'clock at night, so that you keep it truly at 8 hours? And so I think we all have to take better command of the medications that we are taking, and we should know when they're really supposed to be taken, when can we maximize them, and do we really need all of the medication that has been prescribed. So, and if you, before you go to see your druggist, you can go online. There's a phenomenal site put out by the government. It's called it's called Medline, one word, MEDLINE plus, PLUS.gov. And on that site, you will find every prescription med, every vitamin, every supplement that the FDA says grace over, along with a description, what its generic name is, side effects. There's always a telephone number on there for poison control, and it's a good way for you to get better acquainted with what the medications you or a loved one are taking, rather than wait between the doctor or guess at what they are. Anyway, we're going to move on, and the first thing I want to do is I want to announce the winner of the Arden Day of Respite. If you recall, we started a week or two ago, and Arden Court, both the one south on Jog Road and the one north on Village Boulevard, you can have your pick. They are giving a day of respite to a caregiver who is the winner of our weekly drawing. And if you want to be a part of this, and there's no reason why you shouldn't, you can call Arden Court at 561-498-5552, or you can go to the Caregiver Reality website, and right on the front page is a sign-up capability so that you can be in the weekly drawing. Anyway, this week, our winner is Selma Blackburn of Lake Worth, and she is the daughter of her father, whose first name is Henry, and she will be getting the first day of respite that we have offered. And congratulations, Selma. We'll be in touch with you. You can pick either facility, and you can pick out a convenient day, and it's from sunrise to sunset. And they look forward to having you, and all of you that could use a little bit of a break, that could use a little bit of respite, all right? It's that time when the family caregiver gets some time for themselves, not just to go shopping, but get that massage. Tell the girls you can join the canasta game. Tell the guys you can play golf or shoot a little pool. Whatever it is, get away, enjoy yourself, and give yourself that 12 hours that you so properly deserve for being a great caregiver. So again, congratulations, Selma Blackburn of Lake Worth, and we look forward to picking another winner next week. And Arden also has a tip of the week. If you find that it's difficult getting your loved one into the shower, especially for dementia patients, many times they don't know the difference on the floor of the shower or the bathtub, depending on where your shower is, because it's all one color. And even if you have a mat down, many people put a white mat in a white shower, and that causes the caregiver, that causes the patient or your loved one to be unsure of where they're stepping into. So many times if you go get a dark color or a bright colored mat that contrasts the floor in the shower or the floor that's in your bathtub, it makes it a lot safer and a lot easier, and you may find it so much easier to get your loved one into the shower and give him the bath and the shower that he really or she really needs. This week also, AARP came out with some very good tips, and they were talking about family caregivers. Everybody is talking about family caregiving. I've got some quotes coming up soon from Forbes, from the Wall Street Journal. Everybody is recognizing how desperately we need the family caregiver, both the clinical profession, the financial profession, the social world, because caregiving is such an important element in an aging world and in a world where we have chronic illnesses that we have still not conquered, and especially Alzheimer's disease and related dementia. So when I say ADRD, that's what I'm referring to, Alzheimer's disease and related dementias. Anyway, many of you know that some of the tasks that a caregiver performs is bathing, dressing, helping with eating, moving around, and toileting. We call those ADLs, activities of daily living. But many of us are also shopping, cooking, managing financial situations, providing transportation, and these are referred to as instrumental activities of daily living. And the comment that AARP made, that when you look at the whole spectrum of what caregivers are doing now, and that we now know that almost half of those 50 million caregivers that are out there are performing ADLs and IADLs along with a lot of other things. The quote from AARP was that these caregivers are doing things that would make a nursing student nervous before he or she went through a lot of training. And so we have a lot of respect for the caregiver, because unfortunately most of the things that they're doing, they've learned on their own. One of the reasons that I'm here is because caregiver education is so important. That's why this year the Florida Council on Aging, not to blow my own horn, but gave me the Gold Quality Senior Living Award for my caregiver workbook and how you do non-clinical caregiving that's practical problem solving and coping skills. We've got to go to a break. When I come back, I've got a couple of real interesting things that I think you'll want to know. And at 7 o'clock, we've got Jaime Fitzgerald from the Area Agency on Aging just breaking it down for us and telling us what's going on. So off to the break.
Hello, are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
Well, we're back, and it's the Caregiver Reality Show. You can catch us on caregiverreality.com. Just click on Live Show. We're broadcasting here in Boca Raton on WWNN 1470 AM. And if you got a question, 888-565-1470. And I got one more big caregiver tip of the week before I go and read the next segment of Dr. David Hilfiker, who has been writing some incredible blogs called I Have Alzheimer's, and he is going to be a call-in guest on next week's show, and you don't want to miss that. Anyway, my caregiver tip of the week is one that's very important. If you have a loved one that has dementia, and they have a tendency to wander or to get in the car and unfortunately become part of a silver alert or whatever it may be, you need to make darn sure that you have some really good pictures of your loved one. I cannot tell you how many times when I have been called because a loved one has wandered or has gotten in the car and driven away, and I say, do you have a good picture for the police or whoever else may need to have it? And you know what they come up with? They come up with a picture of the two of them on a cruise in 1992 or from 11 years ago with Sam wearing his members-only jacket, and he looks just like everybody else. My suggestion is that now that everybody has a digital camera with a digital phone with a camera in it, that you take a good close-up face shot and then a good shot of them full length, keep it on the phone, put it on your computer. This way, God forbid something happens and you need to have officialdom or whoever it may be going out to look for him, you can download that picture. It's as recent as the last month or so, whenever you took it. And this way, they've got a real good idea of what he looks like and not what he looked like 20 years ago. So please keep good digital documentation when it comes to pictures of your loved one, especially if they have dementia. Anyway, we're back for the fourth sequel of Dr. David Hilfiker, and because he says it so much more eloquently than I ever could, I'm going to be reading excerpts from his latest blog, and I will put my glasses on to do it. You'll notice I'm wearing my wire rims tonight, which makes me look very professorial. And if you're only listening on the radio, that's call in and I'll send you a picture. Anyway, he's on a train coming back from the Boundary Waters canoe area, and the title of this segment is called It's Not Denial. For those of you interested in what I've been doing for the past 2 weeks, the Boundary Waters canoe area in northeast Minnesota was its usual beautiful self. The weather was ideal. All of our children, grandchildren, and son-in-laws canceled and portaged their canoes together through unspoiled wilderness. Even the signs marking the portages were taken down a number of years ago. I'm grateful that each of us enjoys one another enough to have taken on the considerable logistic challenge to get us all together. We've been planning such a trip for when the grandchildren were a little older, but we moved it up because of my diagnosis. As you know, Dr. Hilfiker has Alzheimer's. Quite a few comments over the past several months have mentioned the difficulties for caregivers when the person with dementia refuses to recognize their impairment. Understandably, it can drive some caregivers absolutely crazy. And as a result, the patient that may have financial resources persists in making disastrous financial judgments. They insist upon driving when they shouldn't be. And the important issue about the future can't be addressed. Both caregiver and their loved one get frustrated and angry. One of the things is a term, and this will be the only Medi-speak we'll do tonight, is called anosognosia. And it comes from the Greek word nosos, which means disease, and gnosis, which means knowledge. But because it has an A in front of it, it means just the opposite. It means having no knowledge of the disease. And it's a condition in which a person suffering from a neurologic disability seems to be totally unaware. And he comments, and this is from my medical training that I am saying it, I'm familiar with this condition when caused by a stroke. Victims remain unaware of the affected side of their bodies and will deny that they are paraplegic or hemiplegic, which means one side. But it's also very common in Alzheimer's. Most caregivers understandably interpret this condition as psychological denial, but it's not. A blogger on the Alzheimer's Disease International website wrote, "Denial is a strategy used to reject something that a person wants to ignore or avoid because it's too difficult to face. Anosognosia, on the other hand, is being unaware of the decline in cognitive skills." So we have a big difference. When somebody says, I'm just rejecting anything that you want to tell me, and they consciously know that they're doing that, well, then they're just being stubborn or they're in denial. But when they have dementia and they have no idea that they have this disease, then no longer is it a psychological or an emotional impairment. It is a physical characteristic of the disease. And when we start arguing with our loved ones that have anosognosia, what are we doing? We're arguing with the disease. Fighting with dementia, you might as well go outside, pick a convenient wall, and get it to be on your side, because that's as much recognition as your loved one has of what you're trying to tell them about the disease they have when they suffer from this condition. Research shows that the condition is due to physical damage in a specific area of the brain. The patient has no more ability to recognize the symptoms than he or she does to lift their arm. When Alzheimer's damages these areas of the brain, the patient simply cannot recognize the impairment. The importance to the caregiver of understanding this cause of this lack of awareness is obvious, because trying to cajole or therapize or intimidate a person into recognizing their disability will fail and will lead only to frustration and anger in both the caregiver and the patient. They don't know, and you are arguing with the disease. Recognizing that the patient has no control over his denial, of course, won't change the practical problem, but it might help prevent the blaming and mistrust that the caregiver so often has. Realizing that your loved one can't see that his mind is failing and that no amount of reasoning, nagging, yelling, screaming is going to make a difference might increase compassion and decrease frustration. And that's very important. And doctor goes on to say, although the problem may decrease as the Alzheimer's worsens, meaning as they become deeper and deeper in Alzheimer's, they may forget that they don't know. It's not that they're going to have any greater recognition. But as the author of Contented Dementia suggested in the context of other problems, trying to see the world from the perspective of the person with Alzheimer's will help. How might it feel having others harping on your incompetence when you know yourself not to have an impairment? What is it like to be unable to accomplish something important when you see no good reason why you can't? It is possible for you, the caregiver, to create an alliance with your loved one to reduce this frustration. Can you find a way to agree to disagree, even if they insist upon doing something? I'm not saying something that can be harmful. I still say that if it's time to remove the car, you can't give in and let them drive when they're incapable of driving. But there are certain issues about whether or not they can help in the kitchen, or they want to do this, or a certain television program that you know you just saw it, and even though they insist that they're going to see it again, all right, you can certainly make it a lot easier. Raising your voice only makes a dementia patient more afraid. They don't know why you're raising your voice, and in turn, they try and come back with a raised voice because that's what they think the situation calls for. So as a caregiver, can you find less of a sense that you're betraying the person with Alzheimer's when you arrange for authorities to take the driver's license away, ideally without letting the patient know that you were responsible? Next week or the following week, depending on how long Dr. Hilfiger's on, we'll be talking about how do you take the car away effectively without getting into a huge fight with your loved one. So no amount of understanding, of course, is going to make it easy for the caregiver to respond to anosognosia, all right? But it may make it possible to stay in a better relationship with the person that you love and make it a little more understandable that if you don't know that you have something, how can somebody try and argue with you and convince you that you have it? It's an impossibility. And as I said before, when somebody has dementia and you're trying to be logical and you're trying to persuade and you're trying to use all of your skills that worked 5 years ago, 10 years ago, maybe even 2 years ago, it can't happen. once the brain is damaged in these areas, no matter how loud, how slow, or how often you repeat it, their brain has no ability to pick it up and understand it. And so the sooner you get to a point where you realize that, the sooner that your life will, at least in one small respect, be a little bit easier, because maybe you'll start having fewer and fewer one-sided arguments, because that's all you're doing when dementia reaches the point where they don't recognize that they have the disease. When you as the caregiver don't want to recognize it, that's classic denial. All right? And you do have to recognize it, because anyone that has dementia needs the protection of a really good family caregiver. And that's what this show is all about. Making sure that you as the caregiver know and understand the things that are necessary in order to cope and problem solve. Recall that when we just looked at the AARP and we looked at ADLs, activities of daily living, and instrumental activities of daily living, very little of that was clinical. Most of it, the transportation, how am I going to work this out, getting to the doctor, all of those issues really are practical problem-solving issues. Yes, even going to the toilet, well, it may sound clinical, but getting them to do it, having good hygiene, making sure that that bathroom is safe, that you've got grab bars, that you have all the things that they need to be protected and be safe, is really not a clinical issue. It's a practical problem-solving issue, just like the dark-colored bath mat in the shower or the bathtub. It is time for you to realize that this is what we need to do. We're going to a break in just a moment, because I hear the phone ring, and we have got Jaime Fitzgerald from the Area Agency on Aging, who will be coming on board in just a minute. And he's got a lot of interesting things to say. I've got some really interesting questions to ask him. So let's go to a break and take it from there.
This is Health and Wealth Radio, AM 1470, WWNN Pompano Beach, and WKIS HD3, Boca Raton, Miami, Fort Lauderdale.
Hello. Are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
Well, we're back, and as I said, we're broadcasting to you both on WWNN 1470 AM and CareGiverReality.com. And let's go to our caller. Mr. Fitzgerald, are you on the line?
Yes, I am, David. How are you tonight?
I'm very fine, and I'm very pleased that you were able to call in, because you are such a wealth of knowledge and such a smart guy as the executive director of the Area Agency on Aging, that I've really looked forward to doing this. And I'm glad when I saw you at the FCOA convention that you agreed to come on and do this. And
David, I'm very pleased. Anytime that I get a chance to talk about resources for seniors, for caregivers, and for persons with disabilities, I'm always happy to do it.
Okay, well, you're off to a good start. Why don't you just give us the thumbnail elevator speech on what does the Area Agency on Aging actually do?
Well, I'm going to do it real simply. First of all, the Area Agency on Aging is the organization. It's a nonprofit, and our job, designated by the federal government and the state of Florida, is to be the resource for all senior issues about long-term care, for not only the seniors, but for caregivers, which you are an expert about, and as well as persons with disabilities 18 to 59. And what that means, David, is, first of all, we administer all of the federal programs and the state programs that provide services for seniors in Florida in the 5 counties that we serve, which are Palm Beach, Martin County, St. Lucie, Indian River, and Okeechobee County. And what I mean by these services, these are the services that help people, David, caregivers in particular, to be able to keep their loved one at home for as long as possible without having them go to a nursing home or assisted living, so that then at the point that they have to, then we help them find the assisted living, find the nursing home that they need to go to. That's one of our key roles. The other key role is what I just said at the very beginning. When you have a question about long-term care options, you call our elder helpline, and when you call the elder helpline, we will make sure that you either get the information you need or that we refer you to where you need to go in order to receive the services that you or your caregiver are looking for. And that's called the elder helpline. And if you don't mind, I always like to give the phone number because we can repeat it.
Please, and so I'd like you to give it, and we're going to repeat it again before our conversations are through.
Okay, here's the number. The number is 866-684-5885. If you call that one number, one call will connect you to whatever the information you're looking to or looking for, as well as services will refer you to the right place.
Jaime, is that the equivalent of the 211 hotline?
No, the 211 hotline is a wonderful service that's available to all of Palm Beach County and the Treasure Coast. And they handle lots of types of calls. But when it relates to specifically long-term care issues and long-term care options, the number to call direct so that you don't have to be given to another number, because what will happen if you call them, and what they're going to do is they will refer you to us to give you the specifics, take the time with you. They're helping so many people, and they do an incredible job. But when you're talking to a senior, David, as you well know, or a caregiver, but especially the senior, you got to take time. So it could take 5 minutes, it could take 30 minutes. My gosh, it could take 45 minutes. We are there as specialists on behalf of the state, on behalf of the federal government, to help them with these long-term care options.
Wow. And that number, I'm just going to repeat it now. I'll repeat it again later. Was it 866-684-5885?
That's right.
Okay. Well, that's a number that everybody who's dealing with a loved one or dealing with someone, whether you're above the age of 65 and you need help, you don't understand, then that's the number to call, because there's all kinds of help available to you, and it's brought to you by the state, the federal government, and the incredible people that are involved with the Area Agency on Aging. Now let me go on to a question you can come back and ask, but a question that I think I've been talking to our audience over the last couple of weeks, and I'd love for you to be able to explain it because it still seems a little bit complicated. Would you please explain what is this Medicaid options, which is kind of like Medicaid managed care, that is unrolling, I know, since the 1st of September in all of the counties that you say grace over as the Treasure Coast Area Agency on Aging? Could you give somebody or give our audience just a little better idea of what's happening with that and what they have to do? I know even when people that have Medicare and it's time to enroll are confused, and I think it would be a big help if they could understand better from the authority, from the source, what's going on with Medicaid.
Right. Thank you so much for the opportunity, David, and that's a very important question for your listeners. First of all, let me tell our seniors, those that are currently on Medicare already, you don't have to worry about anything except when the open enrollment for Medicare starts, you need to enroll, get help. And, of course, the other thing that we do, David, is we have what's called the SHINE program, which means Serving Health Insurance Needs of Elders. And what that means is if you are confused and you got a question about SHINE, about Medicare, all you need to do is call the same phone number I gave you, and we have actually trained expert volunteers that will make an appointment with you, and they will help you with your Medicare issues. But that has nothing to do with Medicaid managed care. So if you are currently on Medicare, you don't have to worry about this Medicaid. There may be some things out there in Medicaid managed care that you might be interested in, but the main thing, David, is you don't have to worry. Now, if you are currently on Medicaid, okay, if you currently are on either of the Medicaid programs, regardless of which one it is, you are now going to be, as of September 1st, in Medicaid managed care. You should have already received a letter. You should have already received communication from your caregivers. You should have received that. But if you did not, and you're confused, and you have questions, please, all you have to do is call the same phone number of the Elder Helpline, and we will give you information. And if it looks like you're new, you're not currently on Medicaid, but you could qualify, then we will take care of you right then and there on the call.
Wow. In other words, if somebody qualifies after you've interviewed them for Medicaid, but they haven't previously applied, then you will actually, you're now the determiner of Medicaid eligibility?
No, we don't do the eligibility. Here's the way it works, but we are the facilitator to making it happen. We help you fill out the application, get all the things that you need to get done, and then it will go to the Department of Children and Families for financial eligibility. But we already will help you kind of know whether that's possible. And then secondly, after they get done, then they give you to the Department of Elder Affairs CARES unit, which is the unit that determines your functional eligibility and comes up with a actual level of care. And then you come back to us, and we help you connect with the enrollment broker of the state of Florida, which will be the one to enroll you actually in the plan you want. But here's the key, David. The key is that we will help you know all the options, all the possibilities, and inform you enough so that when you are ready to make that choice, we will connect you with the enrollment broker, and they will take care of it. Now, if you are currently on Medicaid, what you need to do is contact your caregiver, who's currently your caregiver, work with them, and you don't have to go through a process. You will just be transferred into Medicaid managed care. But again, I just want to be real clear tonight, and I want to thank you for the opportunity. If you have any questions that have not been answered by anybody, all you need to do is call the Elder Helpline number that David will give you again, and we will take care of you. That's the key, David, because I will say this.
Well, I'm sure my audience is always interested in understanding. And let me ask you this question, and I'm sure that 866-684-5885 that connects you both with your long-term care capability, with the senior health insurance needs of elders, and anything else that may have to do with the Medicaid program, it's just as simple as one phone call. Question. I know that there are 3 or 4 different providers of Medicaid services in Palm Beach County that have been approved. Do all of them, because I know that on Medicaid you normally keep your Medicare as far as hospitalization, etc. Does the managed Medicaid come with its own separate panel of medical providers so that you need to figure out if your doctors are in a particular Medicaid program?
Not yet. That's the next thing that will be rolled out, but the state has not rolled that out yet. So at this point, everything's intact with your Medicare. Medicaid managed care will have to do with your either in-home services or if you need to go to assisted living, or if you're already there, or you need to go to nursing home.
So, in other words, essentially, everything that's in place right now for a person that's on Medicaid does not change, except that there is now this Medicaid managed care that will be coming in to provide either oversight or whatever it will eventually expand into for the benefit of the Medicaid patient. But nobody has to worry that next week they can't go see their regular doctor or continue on with the regimen of medicines that they're taking. Is that correct?
No, exactly. The only thing that could change after 90 days or within that period is the Medicaid managed care plans will review the care plans of these folks, and they'll see maybe some things need to be changed a little bit or whatever, but they'll work that out with the caregivers, the providers that are currently in place, and they'll work with the clients to ensure that there is continuity of service.
Great. Now, let me ask you this. I know today's only the middle of the month. How have the first 2 weeks been going?
Well, they've been great, but I will tell you this. The increase in phone calls to the Elder Helpline, we've had an increase of about 250 calls a day.
Wow.
And that's been a tremendous increase, and I'm not going to kid you. Anytime you switch to a new program, there are going to be some glitches. What we have done is we have worked with the Medicaid Managed Care Plan. We have worked with our wonderful Department of Elder Affairs, which is the state agency in charge of seniors, and with ACA, which is the Agency for Healthcare Administration, the Medicaid agency of the state. And we're committed to work together so that if there are glitches, David, what we want people to do is call us. Tell us about it. We know how to call the plan, get direct with them, get help. We can call the Agency for Healthcare Administration. We will work on the issue. So that is what I want people to know tonight.
Well, I think, boy, have you given us a lot of information. And one of the things I want to thank you, but by the way, should you come up with any common glitches that you think are a little more universal and not just unique to one or two situations, if you'd give me a call, not necessarily on the air, I would be happy to inform our audience so that if they are beginning to fall into that glitch or that problem area, not only can I re-advise them to call that 866-684-5885 number, but maybe if you have a basic solution to the glitch, I'd be more than happy to let our audience know what that's all about, and maybe it will just be another source of being able to communicate. I'm not saying that I replace anything that you do, but maybe I could be another source of delivering the correct information, because that's what we're trying to do.
David, there is no such thing as too many sources, and that would be fantastic. I do want to end the call on this note. However, if you don't know already today, the 16th of September, what's going on with your provider and what's going on with what plan, and you don't know that today, I would suggest you call the Elder Helpline so that we can look at your case and make sure that everything is on track.
This way, nobody falls between the cracks. Everybody gets what they're supposed to get, and you guys are kind of overseeing the process to make sure that the Medicaid patient gets a fair shake on what it is they're supposed to get and what the promises that these Medicaid managed care have promised to do gets done. Would that be correct?
Yes, that's right.
All right. Well, I want to thank you again for calling in. You've been terrific. It's always a pleasure to have you on, and thank you for filling in so many gaps on what it is that this Medicaid rollout, and more importantly, what Shine and your long-term care capability is all about. I'm going to repeat that number right before we go to the break, and I'd like to thank you again for being here.
Thank you, David, and I'm so glad you're around that you help caregivers. And you are the person to call to help caregivers.
Okay, and that number for everybody out there that wants help from the Area Agency on Aging on almost any elder matter, insurance, Medicaid, long-term care, that's 866-684-5885. 5885. And don't be afraid to call. They're well equipped to help you, and they want to help. We're going to go to a break now. When we come back, I have a couple of very interesting things to talk to you about. Thank you again, Jaime Fitzgerald.
Hello. Are you a family caregiver? Are you taking care of a spouse, parent, or loved one who can no longer care for themselves? Are you dealing with Alzheimer's disease and don't know what to do? Are you stressed, burned out, frustrated, and don't know where to turn? Have you realized that your doctor, lawyer, and mental health professionals don't have real practical answers? You need a non-clinical family caregiver expert that the professionals turn to. You need David Levy. He is a family caregiver expert with 25 years of active experience with thousands of family caregivers. He can help you provide a better quality of life for you and your loved one. Contact David Levy at dlevy@caregivered.org. That's dlevy@caregivered.org. Or call 561-482-0086. And let's get your mental road to healing started.
All right, we're back, and I want to thank Jaime Fitzgerald again. You know, it's always important to hear it straight from the authority, and there's no higher authority than the executive director of the Area Agency on Aging. So if you've got a problem, you know exactly where to go. I'll repeat that number one more time before we close tonight. Like I had mentioned earlier, there are many, many publications that are nationally recognized, and Forbes, Wall Street Journal are some of them. But Forbes had an article that was published this past week. I read it on their online digital edition, and it really, really brought home some issues that I'm aware of, but I didn't think that it had reached a point where people like Forbes magazine had grasped the importance. And the headline for the article was "The Changing Face of Caregivers for Aging Parents." And this was on September 12th, so it's only 4 days old, excuse me. And it starts out, most of us think of family caregivers as 50 or 60-year-olds that are taking care of 70, 80, and 90-year-olds, and that used to be the definition. As a matter of fact, it wasn't so very long ago that, based on the statistics from the National Caregivers Alliance, MetLife, and some of the others, it was a 47 to 48-year-old taking care of a 70 to 75-year-old mother. Well, those numbers are drastically changing. And now that boomers, who are now 65, 66, and are being added into the 65-plus category at the rate of 10,000 a day. So all of you boomers from the Pepsi generation, your time is a-coming. And that's not to say that you should be afraid of aging, because as a gerontologist, I can tell you there's a lot of things you can do to stay healthy and aging. And I live in a population down here where I see a lot of folks in their 80s and even early 90s who look 20 years younger because they go out of their way to exercise, eat right. And I know it sounds trite, but these are the things that kept us in shape when we were younger, and these are the things that keep us in shape now and also help our brain. But the article went on to say that the individual writing the article was saying, "My daughter's friends are mostly in their late 20s and 30s. And a particularly poignant case involved her 27-year-old friend, Karen. And Karen's mom is 64. She's a widow. She has early onset dementia. It started affecting her in her late 50s, and that certainly isn't old when we think about dementia. She had sustained a head injury in a car accident and later developed dementia." I hear this more and more. I have a very, very good friend of mine whose father, at age 52, was changing a light bulb on a ladder, and he slipped and fell and hit his head, and it precipitated the onset of Alzheimer's. And he was only 32 at the time when he became a caregiver. But Karen's mom contracted dementia, and her mom got very confused, couldn't take care of her daily activities. Karen was an only child. She worked full-time, made a modest salary, and lives in a one-bedroom apartment. Mom has lost the ability to manage. First, there was a problem with her retirement funds. A bureaucratic tangle caused her to lose access to her pension, and she was a very well-respected college professor at a very prominent university. But somehow or other, they screwed up the paperwork, and she didn't know how to straighten it out. And I think another thing that we should realize is here's somebody with a tremendous intellect and a capability, and it took but a fall to begin to precipitate dementia. So it can happen a lot of different ways. Anyway, Karen had to step in to assist with the extensive paperwork. Mom couldn't do the appeal nor prove why the system had erred. Mom lost her apartment. She had to move into a board and care facility. We have many board and care facilities here in the Palm Beaches. They're usually single-family homes with 5 to 6 rooms because they've divided out a single-family home. Normally, it is owned by the person that manages it, and they are usually somebody related in the healthcare industry. They're much cheaper than a larger ALF, and usually one bed is available for a Medicaid patient. In this particular case, and this was not Florida, she went to board and care, and the owner called Karen within a couple of weeks to say it wasn't working out, that her mother's behavior due to the dementia was making her unsuitable for their small population, even though the owner knew going in exactly what it was that was occurring. And he demanded that Karen come and get her mother out that week because of the problems that she was creating. Karen got legal advice, and that bought her a little bit of time. My good friend Scott Solkoff can address this. He deals with this issue all the time. He's one of the best elder law attorneys in South Palm Beach County. But in the meantime, Mom's pension still had not been restored. So Karen is stuck, and this is coming out of Forbes, folks. They're usually your financial authority, not one that's talking about caregiving. She was stuck with a terrifying situation, but it's not rare for a person like Karen in her 20s or 30s to be facing responsibility for an impaired parent or grandparent. Karen has tried every available county resource to get help, and unfortunately, she's not here in Palm Beach County because I have a feeling that the Area Agency on Aging could be a help. Even though Mom has not reached 65, I think they would be a help irrespective of the age. But she has cognitive problems and needs further evaluation. The temporary place where they put her would not even make arrangements to take her to a neurologist. And so Karen has now had to figure out what it is that she's going to do. And it's very, very problematic for her because she lives almost 2 hours from where she had to place Mom. And they ended the article by saying no one is immune from diseases like dementia nor tragedies like auto accidents that cause brain damage. No one is guaranteed a healthy middle age or retirement. How many Karens are out there struggling to do this job with or without access or advice? I would bet you, based on my experience in knowing there are 50 million caregivers out there, that at least 15 million of those, they may not be dealing with dementia, but are under the age of very early 30s. And we're going to see this more and more as the boomers age, and their children are going to be responsible for them at an even earlier age than we've seen before. So one of the reasons that it's so difficult, and I'll repeat it again, is that most of this stuff, like trying to figure out what to do about the pension, what to do about moving Mom around in a facility, how to get her to a neurologist, this is all non-clinical caregiving. This is all practical problem solving. This is called keeping your cool and understanding what the system will and won't do and what you can push it to get away with. Because let me tell you, in the world of caregiving, the squeaky wheel gets the oil. However, the pain in the ass doesn't. So there's a very fine line between demanding and asking respectfully but not giving up until you get the answer that you need, or you get put into the place that you need to be, or you move on to the location or the person that can help resolve the problem. One of the things in my caregiver book is exactly how to take on the system and come out ahead of the game. And this is something that everybody is going to have to deal with, whether you're 20, whether you're 30, whether you're 40. Remember, it was only a couple weeks ago that we reported from the AARP that caregiving peaked in 2010 in terms of how many caregivers for how many patients, and it's dropping precipitously here in Florida. So over the next months and years, hopefully, that we bring you this program, we'll be bringing you caregiver secrets, caregiver techniques and tips that will help to make your life easier. We've only got a minute left. I want to thank Boca Raton. Oh, we got 3 minutes left? 1 minute left. We've got no minutes left. So thank you, Boca, America, and the world, for listening tonight to Caregiver Reality. And as I've always told you, family caregiving is not my mission, it's my passion. We will see you next week. We'll be back with Paul, will be on as my co-host, and Dr. David Hilfiker will be our guest. Good night and thank you.
You have been listening and watching David Levy, Gerontologist and non-clinical family caregiving expert. Visit our website at CareGiver